So this morning I was thinking about what's the best way to introduce Pat Remmington. I've known Pat for a long time. And I thought about it. Pat embodies the Wisconsin idea. And as you all know, the Wisconsin idea is to take what's learned at the university and disseminate it to the rest of the state so we could all learn from it. So I got to know Pat because he was really helpful to me when I was a news reporter at Wisconsin Public Radio, an excellent source. And I remember one of the first times he called me, he had some information about obesity rates in Wisconsin. Did a story about it, was a very big story, went front page, all the newspapers did it. It was really a big thing. But from then on, Pat and I were sort of collaborators. He was very helpful to me, and it's always been helpful to news reporters. So that is part of his emphasis as a physician and an epidemiologist. And we ended up teaching a class together. It's Pat's class that I assisted in about 22 years, public health communication, another way of bringing that information out to the public by training medical students and others to go and work with people like me in the news media. Pat has an impressive background, so he's perfect for the topic today. He is a former resident from CDC, a preventive medicine resident. He also was the CMO, the Chief Medical Officer for Injury Prevention at the Division of Public Health. He later joined the Population Health Institute at the University of Wisconsin, and he's Associate Dean of the Public Health at UW. So Pat has this great experience. He's going to talk to us today about the state of public health today and what happened with COVID, why there's less trust among people, and why we have so many people who still have refused to get the COVID vaccine, and what the consequences of that are, and what we might do better to improve the strength of public health in Wisconsin. So please welcome Dr. Patrick Remmington.
Great. I will turn that off. I think. Heather? I'll try to iterate the word. Testing 1, 2, 3. Testing 1, 2, 3. That's great. Sorry about that. Any questions? I can use. If now you're on. I think I'll just put this in my pocket. There. Is that good? Okay. Thank you.
Sorry, I didn't pull that up for.
Maybe get away from here. There you go.
There we go.
Perfect.
Well, thanks for the invitation. It's really a pleasure for me to be here. I've known of the Rotary for many years, and what a wonderful facility too, here on the south side of Madison. I'm born and raised in Madison. Went to West High School, graduated West High School, and sorry about that. Oh, okay. Yeah, growing up here, my dad came off for college, and my mom came down from Greensburg, and they met, and I was born and raised here in town. Is that okay, sound wise?
Yeah. Okay.
So
I'm gonna move this thing back here.
you know, the other thing I could do is just go with my loud voice. Let me do that.
Or just go back to the,
Oh, there's no people can't hear. Okay, that's good.
the Zoom people can hear from that speaker
So let me
if
just
he
do
uses
that.
the microphone.
Yeah, let me do that. Okay, can you hear me all right? Yeah, and how about thumbs up maybe on the on Zoom and folks here? Okay. Okay, well, it's again my pleasure to talk today. I really have valued my friendship and professional relationship with Steve for so many years. And again, I'm officially retiring from the university and no longer formally teaching, but hope to remain involved in public health for the rest of my career. I don't have any conflicts to declare. And again, as Steve said, my path to public health communications came through medical school. So that's a little unusual for a physician to get involved in public health communications. But having worked at CDC for 6 years, a long time ago, and then having circled back with the COVID pandemic, I realized that communications is an incredibly important part, not just of medicine, but of public health. And in fact, translating science into practice is fundamental to public health, not just in finding the causes of public health problems. Again, think COVID. It wasn't that long ago that we didn't really know much about this virus, but also discovering solutions. You have efficacy of vaccines and masks. But this translation process in my lifetime has become very complex and difficult. And in fact, I'm astounded some days when what I consider to be fundamental scientific knowledge is not only doubted, but brazenly challenged in the public. And I think this loss of confidence and what we now call science denial has really become prominent during the last couple of years during the COVID pandemic. So I'd like to just talk about 3 questions and encourage you to think about these. Is there a problem with science denial? I mean, isn't it just okay? People can have their own opinions. What causes science denial? And then really, how do we solve it? So is there a problem with the fact that there are so many people out there that don't believe evidence that scientific community comes to consensus about? Things like the climate, things like COVID, and these issues that you probably, some of you may not be aware that there's a whole group of people that believe we never in fact landed on the moon, that the earth is flat, that there's no such thing as a virus, and the pandemic is all a hoax. And I like to say, Houston, we actually have a problem. This is my Facebook page. I have former classmates from West High School who adorn my Facebook page with facts that they've come across. For example, water now has 4 phases, not just ice, liquid, and vapor, but there's a 4th phase that we should all learn about. I never knew that. That viruses are exosomes, and that the germ theory is actually a hoax. There's no such thing as a germ. And then this post, I hate to pop your balloon, but they lied about everything, and I mean everything. So first of all, who are they? And you know, so here's the God who rid the body of heavy metals. See what's in the chemtrail. And this is not uncommon on social media. So is it a big deal? Who cares if some people think the earth's flat or we never landed on the moon? Well, it turns out misinformation, as we've learned with COVID-19, can affect individual behaviors, like the tendency to wear or not wear a mask, the tendency to become vaccinated, to spread illness to others, but it also can affect policies and government action. So I think there is a problem when people deny science as we know it. And obviously, COVID was a global stress test to see how prepared society was to handle a major pandemic. The US failed this stress test more than any other country in the world. This is from about a year ago, but we had some of the highest rates in the world in COVID. And the Lancet actually did a study and modeled what our death rate should have been based on the G7 countries, and estimated that about 40% of the people who died in this country from COVID could have been avoided if we'd simply put into place what other developed nations were doing with respect to public health approaches. 40% of the million or so deaths could have been avoided. So what causes science denial? There's a whole literature. There's a whole field, if you're involved in communications or journalism, there's a whole field of the techniques in science denial. I won't get into that. It's a very robust area of research. I like to think about 2 causes. There's either people who lack scientific education, and it's unintentional. They just don't know. They don't understand the science, maybe behind vaccines, for example. But there are, I think, there's more evidence that science denial is intentional, and social media is really built on a design system that encourages this. Well, the unintentional causes science actually is not that easy. I was trained in medicine. I don't pretend to be a trained scientist. I'm a physician by training, but I did get an epidemiology degree in School of Public Health, and I trained at CDC. So I know a little bit about the science of epidemiology and of medicine. But I know enough to say that it's incredibly complicated and that it's an iterative process. And when COVID came out, we saw firsthand that science is iterative. You observe populations, you study, you collect data, you make then a hypothesis, you test that hypothesis, and then you revisit it. And what happened in the population was, as we learned about masks and their efficacy or lack of efficacy for both spreading illness and getting sick, messages had to change. They had to evolve with the evolving science. And the general public thought of that as flip-flopping, that scientists don't know what they're talking about. And I viewed that as just, wow, what a fundamental misunderstanding of the scientific process, that we make a hypothesis, we test it, we make observations, and we come back and we've learned. But in the general public, that was actually viewed as a threat to understanding and believing that science is credible. And this led to mixed messages at best. Mixed messages, confusion at best. And I think some people basically threw out the baby with the bathwater and said, they don't know what they're doing, therefore I don't believe anything. But I also believe that there's intentional spread of misinformation. That happened politically within the Trump administration early in the pandemic. Scientists were sidelined, silenced, and ignored. And I sort of have inside information about that because I continued to have colleagues working at CDC. Publication of those reports was intentionally delayed. Some treatments, pressure came from outside, political pressure to approve treatments prematurely. So I know that there were political causes. And this is something that just happened last month. This table was spread through the media, came out of our senator's office. And it looks very disconcerting in that drug adverse event comparison. And here are various drugs: ivermectin, HCQ, flu vaccine, dexamethasone, which is steroid, Tylenol, remdesivir, which is treatment for COVID, and then COVID vaccines. And if you look at this, what do you think the intent of this table is?
COVID vaccines are
Scare
bad.
the hell out of people.
Yeah.
Right? That there are 1.4 million adverse events, 32,000 people died, 17,000 a year. Look at ivermectin is safe, only 16 people have died. Well, this is just fabricated information. It is based on true information from the vaccine adverse effects registry system, but it is not science in that there's no denominator, there's no number of people at risk. We don't know about these 420 deaths, how many doses were given, and you don't understand this whole system, this active surveillance system for adverse events. Every time somebody gets a vaccine and something happens, it gets reported automatically and then it's investigated. Of these investigations, 0 of these deaths have been attributed to the vaccine. That isn't placed into this report. So this is an example of not just misinterpreting the data, but actually using the data to misinform and to confuse the public. And then the social media systems. This is a nightmare in that social media platform algorithms are designed to get you to click, and misinformation spreads on average 6 times faster than true information. And so with each click, you provide information to tech companies about what's going to sell and be promoted. And they want you to buy their ideas. And this gets you down the rabbit hole of misinformation. So given that this is a problem and there are intentional and unintentional causes, what do we do about it? I don't know. This is really complicated.
Yeah.
Wish,
I was like sitting on the edge of my chair.
yeah. This is really, really complicated, hard stuff. This is not like designing an mRNA vaccine and, testing it in randomized trials. This is much more complicated than traditional science. I do think I have some ideas. Unintentional causes. I think we just need better education, science education. I wish our high school teacher was here. I would acknowledge her work educating young kids about science and being literate. Intentional causes, I think we need to use the power of regulation and law. And just, I'm sorry, I'm a believer of the First Amendment, but at sometimes you don't yell fire in a movie theater. And I think communications that intentionally misinform and lead to bad health outcomes should be viewed as yelling fire in a movie theater. That if you intentionally harm people through your communication, one could argue that that's something someplace we need to intervene. There's a great media bias chart showing that there's bias on both sides. These are the far left reports that you might be reading, and these are the far right. But as you go up, reporting gets more factual and more analytic. And so I try to have my students focus on things that are not partisan and that are based on fact. You can see Reuters, you can see PBS, ABC, BBC, NPR. Those are the sources of news. And again, this is available online. You do media bias chart. You can sign up and get your free copy. And not that I don't enjoy sometimes reading the craziness at both ends of this spectrum. But I think understanding where bias is the first step in better science education. So in conclusion, the COVID-19 pandemic has revealed significant problems with science denial. This has exploded in society. And I think we need to hold both corporations and business and industry and social media accountable for the health and economic costs of some of this intentional misinformation. And we all need to do our part to communicate clearly about science. And so I think individually, just get your information from trusted sources. There are a few trusted sources out there. CDC has throughout this entire process, despite the political influence, remained a trusted source. We know what those are. And so we should avoid those rabbit holes, no matter how tempting it might be, to say, I heard on the internet, or I followed this thread. I think we can also serve as trusted sources of information. Inform yourself about science and public health, and then serve as a trusted source of information. And then finally, my little political focus is I think we should support our representatives who also use evidence, good evidence on science to support evidence-based policies and government approaches rather than misinforming people for political gain. So I think that's my last slide. I wanted to have time for comments or feedback. Yeah.
One question. One of your solutions was improving the communication of public health to us.
Yes.
Do you have a specific, I hear that, yeah, we should do a better job, but are there things in the works to get a more robust message coming from public health to?
It's a really interesting question, and maybe to repeat it so everybody could hear that. How do we do a better job of science communication or public health communication? My experience, having worked for government for 15 years at the state and at the CDC, is that government is a political by nature. And sometimes politicians are reluctant to take the risk of being out in front. And you've seen it in COVID, right? So the politician may not want the news about an outbreak in a cruise ship might be bad politically, but it is essential public health information. So I think in government, we need to separate our sort of governmental public health from the political process. And sometimes having a Surgeon General, I think Tony Fauci did a great job of being that person who really thought hard about science and used his best research and best background to make evidence-based recommendations. And he was somewhat insulated during many of the years of COVID. So I think our state has done a pretty good job of that. Ryan Westergaard is the state epidemiologist. He is very reasoned and smart, and they do a pretty good job of communicating. So I think it's a challenge. But I think about trusted sources, and whatever those might be, that's where I mean, I go to the New York Times. It's a very central, it's one of the sources that I find. PBS, New York Times, you know, is a trusted source. Yeah.
How easy was the chart from Ron Johnson?
That was last month. I was asked to comment on it, and I was just at a loss for words. I said it's in my field, it would be considered medical malpractice to put out a chart like that.
Oh,
And if that led to people declining vaccine and led to an outbreak in a facility, say a nursing home or something, or in a community setting, then I think the people who purvey information like that should be held responsible. That's incorrect information. I know how you interpreted it, right? It's just so obvious how that was intended to be interpreted. What I said, and what I was quoted in the Milwaukee Journal, I said, if there's going to be a hearing on the potential harms of a vaccine, let's balance that hearing with the potential benefits. So if there are some side effects, there's nothing we do in medicine that doesn't have a potential harm. But it needs to be weighed against the potential benefits. And that has never been part of the senator's hearings, which is to weigh the benefits and harms of vaccines. So that's my view, is that's not fair and balanced use of evidence. You know, so that was my recommendation, is try and be balanced and nonpartisan in reviewing science. Yes.
I think it's gotten very, very positive. And you know, and it's unfortunate. The science that say science is real. Science is always changing. Science is always improving. And so there's not one thing that's going to be definite with that. You know, I look at some of these things and follow both sides. And I've got no shot. But I hear both parts. I hear both sides. I guess when you talk about Fauci, you know, there was a lot of things that he said, and I guess just his that whole lab in China, where he was involved with that to begin with. You know, some of this kind of stuff is just coming out a little bit. You should know a little bit more.
And again, I would go, because I know quite a bit about the theories of the origins of coronavirus, the novel coronavirus. I think I'd go to a trusted source on that, which is what I do. And nobody has ever said that it wasn't possibly a lab error. The response to the two approaches, right? It either came out of the wild game markets or there was a lab error. Whether you believe it's a 1% and a 99% or flip it the other way, the response is identical. We need better lab safety, and we need to control the sale and of wild game and the bringing of humans and animals together. The response is identical. Nobody, Tony Fauci, nobody ever debated the response. That's how I viewed that debate. The debate is ridiculous. Why? I understand that there may be a culpable party, but for public health, the answer is continued better laboratory vigilance, right? And more open communication from China, and less opportunity for animals to jump, for viruses to jump from animals, wild game particularly, to humans. The response is identical, no matter what you believe, right? And that's why I try to get belief. This is not a question of belief, this is a question of evidence. My review of the evidence, the most credible evidence, is that it was most certainly an example of viruses coming from wild game. There's credible evidence of that. You cannot rule out the possibility of laboratory accident. So I think, but the response of that is the public health response to the debate is it doesn't matter what the evidence is the policies are the same. We need better laboratory safety, more openness in those settings, and separate wild game from humans in those markets. And so that's Other. I see we're approaching time. Yes, Steve.
I read a report recently that, there's still a substantial portion of the public not vaccinated. You have the free effective vaccine and they believe the risk is higher to get the vaccine than not. What does that mean for the rest of us in terms of controlling the pandemic?
That's a great, I've given other talks on, the issue of sort of, the difference between protecting your own health and decisions made in your own best interest and protecting the health of others. And there's an important nuance. Many of us believe that, that we should have the freedom to choose our own health, right? Our own practices, our own ability. And I believe that as a person who values liberty, I don't want somebody telling me what I can and can't do. However, the analogy is you can swing your arms about as much as you want, as long as you're not swinging in front of my nose. And so the minute your decision affects others, now you've crossed from individual liberty into what I call public health. So your decision to stay home and drink in excess, to smoke cigarettes in your own automobile, to eat to your heart's content, those don't affect me. But your decision to drink and drive, your decision to carry a loaded firearm or maybe have one present where children are, those affect the health of others. And your decision not to be vaccinated affects the health of others because you've increased the risk of yourself getting the disease and transmitting it to others. That's where society comes in. That's where we come together in groups like this and say, what do we do as a civil society when somebody's individual decision affects the health of others? We generally say if it's affecting you, I'm okay. Why would I get involved in decisions that are solely for you? But when your decision affects the health of others and potentially can harm or kill others, then I think society has a responsibility to intervene. And we have drunk driving laws. We have, you can't smoke cigarettes in here, I don't think, right? That's a right that was taken away in my lifetime. And it was taken away not because I don't want you to smoke, it's because I don't want you to harm the health of others. Yeah.
To your point of not having a solution, I suspect if you polled 1.2 million Rotarians and asked them whether they believe everybody on the planet should be vaccinated for polio, they'd all say yes. If you polled them and said, should you be vaccinated for COVID, say yes. 60%, 70% would say yes. So, I mean, the whole politicization of this, and it's just interesting because with this specific demographic, we've waved that vaccination flag all around the world. But if you ask the same group about this one, and the real question is why?
I'll just posit on that, maybe as the last comment, is I think when polio vaccine was coming out, number one, the only media was the number of kids on iron lungs and the consequences of not getting vaccinated. We are very protected from the harms of COVID. You don't see the things that we see in the hospital, the people dying at the end of life from COVID. You're very protected from that, and that's a good thing. We don't want the general public to see the harms. The second thing is back in that day, if you doubted polio vaccine, your ability to find alternative information was tough. I mean, there was the Sabin versus Salk debate. Did anybody know about Sabin and Salk? Mm-hmm. Well, that was a robust debate in the 1960s. But you had to be reading primary literature and medical journals. Now, if you want to get information about something, click, follow that rabbit hole. So we have made information about potential harms just at your fingertips, and social media designs to just promote that. That wasn't there with polio. I think if polio vaccine came out today, there'd be all sorts of rabbit holes to follow to keep people from getting vaccinated.
Both information and misinformation.
Misinformation, yeah, on the harms, because there are harms from, sorry, I don't want to spoil your understanding of polio vaccine. There are harms from polio vaccine, particularly the live virus vaccine, but the benefits are, amazing. Okay, thank you.